What rare bladder conditions does a cystogram reveal? Imagine a test that can help uncover hidden issues inside your bladder and urethra. A cystogram, especially avoiding Cystourethrogram, is a special X-ray procedure that shows how your bladder fills and empties. It involves inserting a small tube into your bladder, filling it with a contrast dye, and then taking X-ray images as you go to the bathroom. While it's mainly used to check for common problems like bladder leaks or structural abnormalities, it can also hint at some rare bladder conditions. Rare bladder conditions are often tricky to diagnose because they don't always show obvious symptoms or appear on standard scans. A cystogram can sometimes reveal unusual bladder shapes or filling patterns that suggest these conditions. For example, if the bladder appears irregularly shaped or shows abnormal filling during the test, it might point to certain rare issues. But it's important to remember that for detailed views of the bladder's interior lining or tissue, other procedures like cystoscopy, which involves inserting a small camera into the bladder, are more effective. One rare condition that a cystogram can sometimes suggest is bladder cysts. These are small fluid-filled sacs that develop on or inside the bladder wall. Usually, cysts are better seen with ultrasound or computed tomography scans, but if a cyst is large enough, it might alter the bladder's shape enough to be seen on a cystogram. Another rare condition is melanosis of the bladder, which involves dark pigment deposits in the bladder lining. This is very uncommon and is usually diagnosed through cystoscopy and tissue biopsy rather than a cystogram. While cystograms are not the best tool for detecting bladder tumors, they can sometimes show abnormal filling or irregularities that prompt further testing. For instance, if a tumor causes the bladder wall to thicken or deform, it might be visible indirectly. But more detailed imaging like computed tomography or magnetic resonance imaging is generally preferred for identifying tumors or other internal growths. Interstitial cystitis, a chronic condition causing bladder pain and pressure, is also not directly diagnosed with a cystogram. Instead, doctors use a combination of medical history, urine tests, bladder diaries, and cystoscopy. A cystogram can help rule out other structural problems that might cause similar symptoms, but it's not the primary test for this condition. In summary, while a cystogram is a useful tool for evaluating bladder function and structure, it's not the main test for most rare bladder conditions. It can sometimes suggest the presence of unusual shapes or filling patterns that lead to further investigation. For detailed examination of the bladder lining or tissue, procedures like cystoscopy and biopsy are more precise. Always remember to consult a healthcare professional for personalized diagnosis and treatment options, as each case can be quite different.